Hey guys, how you doing? Frank Gonzalez, G&G Productions, bringing you another protocol video reading directly from the Lee County Common Treatment Guidelines book, revised in 2021, which is the most current version we're going off of. And today I'm going to read to you from the stroke protocol, 2 pages on this one, basically how to assess 3 types of strokes and where to take them and which type of stroke alert to call. It's quite a bit, but I think we'll get through it pretty quickly, and it's basically pretty easy. So let's go ahead and jump right in. For the differential impressions, for the ischemic stroke side, we're going to have a thrombic, embolic, large vessel occlusion, or transient ischemic type of stroke. And for the hemorrhagic stroke, intercerebral, subarachnoid, epidural, and subdural bleed. Know the hemorrhagic strokes, they have the highest mortality rate, and you're usually not going to get any kind of response at all from these patients. They're going to be very obtunded, unresponsive, loss of bladder and bowel movement, seizures maybe beforehand. Like I said, super high mortality rate. They die very soon after having the stroke, and there's usually no coming back from it. Usually. I'm not going to say always or never. Basic life support actions, universal care guidelines as prescribed in a previous video I did, patient safety guidelines. Blood glucose under 60 milligrams per deciliter. Any diabetic emergencies, hyper or hypoglycemia. The first pearl here, dextrose may worsen neurological outcome in stroke, so use glucose with caution. Yes, they may have a blood glucose less than 60, but I've seen diabetics with a blood sugar of 40 still able to answer questions and totally with it. It's not until they get under that then they start to need sugar. So ask family members if they're acting accordingly pertaining to how they're supposed to be acting with the blood sugar that they have. And then we get into perform a Lee County stroke assessment checklist. There's 3 types. There's a fast stroke positive stroke alert. There's the VAN stroke positive stroke alert, and the hemorrhagic stroke positive alert, right? And we'll go over this in the next page. For your advanced life support, if you feel they're in need of fluids, we're going to give a crystalloid solution, 10 mLs per kilogram. Pediatrics, we're going to give 20 mLs per kilogram. And the pearl underneath that is crystalloid resuscitation is aimed at maintaining cerebral perfusion. That's why we want to give them fluids. There's really not a whole lot we can do for them. Nausea and vomiting management guidelines as necessary. Next pearl under here, antiemetic therapy is aimed at reducing intracranial pressure. Anytime we heave like that or bear down, we're actually doing 2 things. We're stimulating our baroreceptors to slow our heart rate down. And 2, we're increasing our intracranial pressure. That's why sometimes when you go to the bathroom, you bear down too much, you get those headaches, because we're causing intracranial pressure. And then at the bottom down there, if you need further assistance on knowing what to do with these patients, maybe a diabetic patient, blood sugar under 60, you're trying to figure out whether or not to give them blood sugar, get medical control on the line and have them assist you in making those decisions. Don't make them alone. Don't do guesstimations, right? Because we have a phone call away, we could phone a friend. Now, our ischemic strokes are fast, VAN, and hemorrhagic, our fast and VAN. Our fast stands for face, arms, speech, and time. Face, any facial drooping, facial unevenness, hemiplasia, periplasia. Arms, unilateral arm drop. If we have the patients raise their arms, put their palms up in a supinating position, close their eyes, one of the arms drops and goes down to the pronating position, just like the picture shows up on the screen right there. As speech, if they have slurred speech, difficulty speaking, aphonia, able to mouth the words but not produce sound, that's what aphonia is. Not aphonia, I'll call it later, right? That's not what that is. And inappropriate use of words as well. What's your name? 17. That's not appropriate, right? And then time, last known well, less than 24 hours. Any patients that have these ischemic strokes that are over 24 hours, they have a difficult time giving them medicine or to bring them back to where they were, or doing the procedures that they need to bring them back where they were. So time is muscle. Remember that? If we could get to these patients before a 24-hour period, they're going to have the most benefit. And then our VAN exam, visual, aphasia, and neglect are visual. Do they have sudden unexplained blindness, double vision, any visual disturbances, spots, white spots, or something like that? Aphasia, expressive aphasia. Are they not able to tell you what they're feeling? You show them, you know, this, what is this? And they say keys, and you're like, no, they're like, keys, they're frustrated. They know what it is, but the words come out incorrectly. Expressive aphasia. Receptive aphasia, you know, you tell them again, what's this? And they say, you know, a Jello. No, that's not right, but they're certain that's what Jello is because they have receptive aphasia. So, and they might have a combination of both, either expressive or receptive aphasia. Then you can't be able to assess them at all, right? It's all guesswork at then. Maybe by blinking once, blinking twice. I have had patients like that in the past where we communicated by blinking, and it was successful, just like the movies. I'm not even kidding. Under neglect, they neglect one side of the brain completely. This is my right, your left, right? If I ask them to look to the left, they're not going to look to the left. They're actually going to come all the way around and look to the left. If they were to look at a clock, or you ask them to draw a clock, like the one up on the screen right now, they would draw you a clock 1 through 12 on one side of the clock, not realizing that they're neglecting the other side of the brain. That's why in their mind, the clock doesn't go all the way around. That's how it exists in their mind, in their brain. So they would be neglecting one side or the other. That's where the neglect comes from. So on the fast positive exam, right, if they have facial drooling, arm drift, speech impediments, and longer than 24 hours, that's going to be a fast positive stroke alert. If they have visual disturbances, any kind of aphasias, and neglect, that's going to be a VAN positive stroke alert. And then the last one, if they have any bleeds, maybe the family member says that they were complaining of the worst headache they've ever had before they went obtunded. Maybe they had a seizure before they went obtunded. They were eating dinner, talking normally. All of a sudden, they just stooped down, started drooling, and had no response after that. That would be signs of an ischemic stroke. Loss of bladder and bowel movement, that would be another sign of ischemic stroke. Like I said, be aware that the hemorrhagic strokes have the higher mortality rate. I can't remember the exact percentage. I don't know why 65% comes to mind, but a huge percentage of the people that have a hemorrhagic stroke end up dying because of that stroke. And we're going to take these patients that aren't VAN positive, fast positive, hemorrhagic strokes, we're going to take them to a comprehensive stroke center. Currently, there's only one comprehensive stroke center in Lee County, and that's Gulf Coast Hospital, also known as D5. If you're closer to Collier County, we have 3 hospitals. We have North Collier Hospital off of Mockley Road. We have Pine Ridge Physicians Regional off of Pine Ridge. And we have downtown NCH, which is also known as NCH Baker. So we have a little bit more options in Collier County. We only have one comprehensive stroke center in Lee County. That's really about it for this one, guys. What I wanted you to pull away from this is knowing where your comprehensive stroke centers are. We have 1 in Lee County, and we have 3 in Collier County. How to do a VAN positive, a fast positive exam, and when it's a hemorrhagic stroke. A lot of information, but fairly simple. Nothing too crazy. With our diabetics, be careful giving them sugar. If you have any questions on whether you should or shouldn't, get medical control online. That's why it's on the bottom of that protocol, so you can call them if needed. That's about it, guys. If you have any questions, comments, concerns, please leave those down below. Don't forget to hit the like and subscribe button as well. And again, thanks for watching, guys. For Gonzalez with G&G Productions. We'll see you on the next one.